Hello, I am Dr. Mirela Cherneyanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. In this podcast episode, I'd like to talk about the wellness exam and the focus that a physician should have, or the patient should have, if it's a man or a woman in their 30s. So again, this is a wellness focus for our 30s decade. I started with the teenage years, I went forward to the 20s, and now it's the 30s. And I believe this is a very important podcast episode and a very important topic for two reasons. Because, first of all, women in their 30s, most of them are tackling motherhood, and preparing mentally, physically, and emotionally for this task could be a very large, time-consuming, and sometimes very stressful undertaking. Whereas for others, it comes naturally and easily. And also, the majority of women are not aware, but this decade in their lives, the 30s, is, and what happens with their health in this decade, is what sets them up for a very smooth, maybe easy, or maybe difficult perimenopause stage, which happens in the next decade, in your 40s. Now, for men, it's also very important because both men and women in their 30s should be at their peak. And no one talks about this, but you should know what your health looks like at your peak. You should know what your health markers are, and you should definitely go see a physician that can look at the big picture. And if you do feel that this is great and you have no problem in your 30s, then again, annually, you want to keep an eye on what's happening. And I'm going to talk about some of the things that are not necessarily health markers, but things that you could look and take care of and pay attention to your own body, because your body will give you signs and symptoms. And that's what I want to talk about in this episode. So again, if you're a woman or a man in your 20s heading to your 30s, please listen carefully, as you might not hear this perspective from other physicians that are doing wellness checks. And again, I'm going to provide you with what I call a roadmap to your health problems and a tool that you can use for self-analysis. And again, every time you feel confronted with a health challenge as a woman or as a man, you can realize you have a problem before this problem becomes a strong, serious health issues that it will take serious effort, time, and financial expenses to address and hopefully resolve. So that's what I want you to take away from this podcast episode. This is probably going to be split in a few parts, but it's a roadmap and a self-analysis tool. And again, I'm a firm believer that this decade in your life as a woman or a man is when you should be at your peak. You should feel your best. The awkward teenage years are behind you. You're done with also the awkward early to mid-20s when you're trying to discover yourself, understand your role in the world and what you want to be as a human being. By now, hopefully you have chosen a career path or completing some form of education to get you there. Hopefully by now you have a stable partnership with your significant other, and you might be considering settling down or starting or growing your family. So if you have not reached any of these two milestones, career or family life, please don't feel bad about it. When I was 35, I had just finished my OBGYN residency program at LSU, Louisiana State University in New Orleans. And I was moving to Miami for my first job as an OBGYN, and I wasn't dating anyone. Again, my career as an OBGYN in the US was just starting, and I was not in a relationship. And ultimately, it is true that as a woman, I did sacrifice my personal family life and my very small aspirations to be a mother for the sake of my profession. But I loved and I still love what I do. And I loved what I did back then. And I was a very single-minded, focused woman that had no time to think about starting a family. I was 36, 37 when I met my husband and 39 when we got engaged. By the time I was 40 and wanted to start a family, it turns out my ovaries had run out of steam. But if you had listened to my previous podcast episode, I did share this story before. But the point I'm trying to make is that I personally delayed my fertility, not really thinking anything about it until it was too late. And I'm sharing this with you because I want this to be a lesson for all the young women who think that they have all the time in the world. As far as fertility goes and as far as ovarian egg quality goes, as women, we do not have all the time in the world. Our eggs are most fertile and healthiest in our 20s and probably early 30s at the latest. Does this by any chance mean that you cannot get pregnant after 35? No, that's not what I'm saying at all. Does that mean that it might take you longer and require more of an effort to get pregnant after 35? That's the message. After 35, not only the number of eggs, but the quality of the eggs that is put out by the ovaries of a woman each month is in a steady decline. So at this point, depending on when you started your first period, you might have already run out of eggs if you started early at 11. Imagine and consider the fact that your body has been churning eggs every 25 to 35 days for over 20 years at this point. Your body is very smart, wants to conserve energy and resources. So if you're dealing with a stressful career, a stressful relationship, a stressful situation, your body knows to preserve your energy where is needed the most. And usually it's somewhere else. Your body needs to work to give you a better adrenal function, a better thyroid function, or maybe it just simply needs to work to preserve your mental and emotional health. And that is always going to happen at the expense of your reproductive system. So please keep that in mind. Stress is an egg quality killer. Stress is an egg number killer as far as reproduction goes. So after this short message about fertility and the delay of starting a family, which most women nowadays are strongly considering, we see this push for childbearing all the way into the 40s. So again, word to the wise, please take into account what I'm saying here. But let me get into the wellness check for a woman in her 30s and a man in their 30s. So again, I'm going to spend some time on this roadmap I told you about. And please understand that a physician or provider, whether it could be a family nurse practitioner or physician assistant, that takes their time and asks or inquire about everything I'm going to talk about in this podcast today and next week, as a provider, as a physician, is worth keeping. And it's worth forging a relationship with. Because this type of provider, physician, nurse practitioner, PA, has the most chance to help you understand and address the core issues around any health problems you might develop. So obviously everything I said in the previous podcast for the 20s decade does apply to the 30s as well. All the health issues that we talked about, all the markers and everything about the wellness check. However, what I'd like to focus on today and the next week is the review of signs and symptoms, review of symptoms and review of systems. Because this is what is going to tell your doctor or yourself if there are any subtle underlying early warning signs of a dysfunction where your health is concerned. Now, this is where you want your doctor to be as comprehensive as possible, because an in-depth analysis of all your systems every year in your 30s is going to help you detect problems early on, tackle them and solve them promptly before they become any kind of major issue. So I'll go down point by point and review for you what we doctors call ROS, or review of symptoms, and explain why this is so important in your 30s. Let me go down systems one by one. And there's quite a few of them. The constitutional symptoms, your eyes, your ear, nose, and throat, your cardiovascular health, your lung health, your digestive health, your musculoskeletal health, your genitourinary symptoms, and system, your neurologic system, your mental health, your immune system, and the what we call hematology or bleeding issues. So it's pretty much going down point by point and reviewing all the body's major systems. So let me start with number one in this episode, and I'll address constitutional symptoms, eyesight, ear, nose, and throat, cardiovascular health, respiratory health, and digestion. We'll move on the next podcast episode with the rest. So let's talk constitutional symptoms. Why does it matter? Well, you're in your 30s, you're in your peak, you shouldn't have any of these issues. The top constitutional symptoms that are concerning are fatigue, insomnia, weight changes, all kinds of things with your digestion, just an overall overview. So let's talk about fatigue for a few minutes. I don't want to make this episode about fatigue, but all you need to take home from this is that you are at your peak in your 30s. There should be no fatigue, whether you're a man or a woman. You should wake up in the morning energized and ready to go, excited about your life. And you should be able to do all the things you want to do in your day, be able to pack an hour of exercise at the beginning of the day, at the end of the day, whenever, and have some dinner or some entertainment in the evening, whether it's a movie, going out on a date with your girlfriends, or whatever else you like to do after dinner. You need to have the energy for all of that. And again, that is because you are at the peak of your development. And if you are healthy, there should be no fatigue. So I want to dedicate a few minutes about fatigue and let you know that fatigue is a very early symptom or sign of a problem. It could be a hormone deficiency, low thyroid, high thyroid, low adrenal, high adrenal. It could be a problem of sex hormone deficiency. It could be something as simple as a vitamin deficiency or just a sleep quantity quality issue or both. And the list goes on and on. I don't want to get into details because, again, this is not a podcast episode about fatigue. So consider the fact that you should have great energy. That's the point. Number two, constitutional symptom that many fail to pay attention to and not discussed at all with the doctor during their annual checkup is your sleep pattern. Maybe by now you already have a child or two. Maybe by now you have a very stressful job. Maybe you're going to school, seeking a degree, studying day and night in order to become successful and launch your career. Even if there's a valid reason for the poor quantity and poor quality sleep, unfortunately, this problem will come back to mess you up when you least expect it, which is in your 40s and 50s. Consider the fact that your body regenerates during sleep. Lack of sleep will create a deficiency and a deficit in your regenerative restorative capacities. And it's not like a deficit in the bank that you can pay off later by sleeping more later, delaying sleep. Unfortunately, a constant recurring dysfunctional sleep pattern can become permanently dysfunctional. And again, nothing is as true as this is for our sleep pattern because it's so intimately tied into our circadian rhythm. So normal human beings should get up in the morning and go to bed at night. And unfortunately, due to stress, career, and other things, we do a lot of staying up at night and sleeping throughout the day. And whether you do that when you're young and it just keeps happening, it will mess up your sleep pattern. And that's a terrible thing for nurses or healthcare providers who have to work night shift. Imagine needing to work 3 or 4 times a week at night only. It will really mess you up. And there's multiple studies showing that the lack of sleep, the chronic lack of sleep, messes with our immune system, our hormones, slows down our metabolism, creates a lot of problems for our weight, our mental health, and increases our risk of cancer. So what I'm saying is if you are intentionally experiencing a disturbed sleep pattern, again, studying, stress, career, job, you need to work on fixing it, finding a better solution. If you are unintentionally experiencing a dysfunctional sleep pattern, then please address that with your doctor as soon as possible. Many people don't even think about talking about sleep, and that is very important. Let me move on to the third most common constitutional symptom that needs to be reviewed with your doctor, and that is your height and weight and your body mass composition. This is where you want to consider doing an assessment of your overall weight. And has that been stable in the past 6 months to a year, or is it changing? Now, your weight could have been changing gradually for the past 3 years. Could have been going up or going down. Any significant weight changes that are going up, going down, or anything that's related to the fact that you're not where you want to be as far as your weight needs to be discussed with your doctor early on so the problem can be reversed. So let me mention the body mass composition a little bit more. I do have an anti-aging and restorative practice, and I do offer in-body measurements for a minimum cost of $50. You can get this at any gym. Many gyms now have this device where you can measure the body mass composition. Why does this matter? Well, because after 35, in your 40s and 50s, you are no longer able to build muscle mass like you're in your 30s. Remember what I said about your 30s being your peak? I'm not joking. If you spend your 30s decade without investing in maintaining or building your muscle mass, you are very poorly set up for what's to come. After, in your 40s and 50s and beyond, you're going to have to work super hard. Once you get older, now you're more savvy and educated in your 40s and 50s, you're going to be confronted with a much more difficult situation. Now you need to spend money and time and energy on devices that can help create what we call a supermaximal or supramaximal contraction, because your capacity to generate muscle contractions as you get older is subpar. It's nothing compared to what we used to do in your 20s and 50s. Again, the reason for that is because your anabolic hormones are declined in your 40s and 50s and beyond. And unfortunately, by now, you probably drink more alcohol and you likely eat more refined foods. So there's more inflammation. Plus, our body's aging, our muscles are weaker. And I hope I stated my case here. Let me move on to the next system, and that's our eyesight. This is very important because this is our peak. In our 30s is where we are at the best of our health. So if we experience any eyesight problems, now it's just going to continue to get worse in your 40s and 50s. So please address them. Let's talk about hearing and ear, nose, and throat. Well, you shouldn't have any hearing issues in your 30s, and your ear, nose, and throat health should be outstanding. However, many women and men at this age range unfortunately suffer from allergies. A dysfunctional immune system will present with allergies, environmental allergies, and then more allergies like skin rashes and eczema, postnasal drip, sinus issues. And unfortunately, that just kind of leads onto the path for autoimmune disease and the ultimate immune system dysfunction, which is cancer. So see where I'm going with this? Do not ignore your allergies, please. And if you have allergies, please keep in mind that taking Zyrtec does not fix the problem. It's a Band-Aid. Consider a functional medicine provider that can help look at your immune system, at your intestinal health. Consider doing a food sensitivity test, because both your immune system and your digestive health are likely having a problem expressed as allergies. Again, just a warning. You should have no allergies, and many men and women in their 30s suffer from allergies. So please address them. Don't let this become a bigger problem. Let's talk number 4, cardiovascular health. Again, you should be at your peak. You should have no chest discomfort, no palpitations, no irregular heartbeat, no shortness of breath at rest or when you exercise. One of the things you don't hear discussed or reviewed at all is what we call resting heart rate. Now, your doctor does not evaluate that. That's because your resting heart rate is something you check first thing in the morning when you're lying down and barely come awake from your night slumber. This, however, is a great indicator of your overall resiliency, not just for your heart, but it indicates whether or not your adrenergic system, or also called a stress response, is overactivated and you have an imbalance, which, trust me, if left undetected, unaddressed, will probably lead down the path to hypertension and heart problems. The lower your resting heart rate is, the better. 60s to 70s is where you want to be. Just humor me, and next morning when you wake up after listening to the podcast, just simply reach over and slap that iWatch on your wrist and check your heart rate before you get out of bed. Let's talk about lung health. Your lung capacity and the health of your respiratory system is frequently overlooked. It's not being looked into unless you have a big problem. However, as we get older, our lungs, which are responsible for our capacity to oxygenate our body, are absolutely vital. Nothing works in the body without oxygen. So we can't live without lungs. And again, you're at your peak at your health in your 30s. So as a man or a woman, there should be no shortness of breath, no wheezing, no bouts of coughing. You should not be one of those women prone to frequent respiratory tract infections or still suffer from childhood asthma. So I hate to preach, but it's a wellness podcast about wellness from a doctor. So I want to talk a little bit about this. This is the point where you want to analyze what you're doing to protect your lungs. And if you, by any chance, are smoking tobacco or vaping, this is a pretty bad habit. Very, very unhealthy and definitely damaging to your delicate lung tissues. It's also, unfortunately, addictive. And it's extremely unhealthy, not just because it destroys and scars and fibroses your lungs and diminishes your oxygenation capacity for life, but also because the nicotine and the ingredients in the vaping have so many bad consequences for your health, for your overall health, including your ovaries. And yes, probably for testicles as well. They will affect your sperm. There's clear evidence that smoking tobacco or vaping will damage your eggs, will decrease your egg reserves for women, and negatively impact your egg quality, and will impact sperm quality and number for men. So to end this system review, please remember we cannot live a healthy life without the ability to breathe and oxygenate our tissues. So please do not take your lungs for granted. Next and last in this episode is your digestion. Let's talk about how your doctor should address this. Well, the doctor should inquire about your digestion by asking you about your bowel movements, by asking you if you experience any abdominal pain, by asking you about whether or not you have heartburn, whether or not there's any problems with bloating. And all of these are very important signs and symptoms. So let's talk poop for a second. You should have a very normal, daily, well-formed stool. And it really should happen 90 to 99% of the times, at least once a day. You should never have diarrhea, or if you do, it should be rare and always related to something. Maybe you ate something bad, you traveled somewhere, drank contaminated water, Mexico, India. Again, I have nothing against these countries, but they're not known for best sanitary conditions unless you're at a resort. In any other conditions, persistent diarrhea is abnormal. Again, you should not be constipated, which is the opposite of diarrhea. Now, a lot of people do get constipated when they travel, and that's probably okay, but it should not be persistent. Chronic constipation could be a sign of low thyroid, of dehydration, of lack of fiber in your diet, of too many processed foods in your diet. It could be a sign of lack of physical activity, a sign of IBS, or an overactive stress response. Yes, you heard it right. Stressed people are usually constipated people. So why does it matter? Well, it matters if you have digestive symptoms because a dysfunctional digestive system means a poor quality microbiome. That is the friendly bacteria in your gut. A bad, dysfunctional, messed up microbiome is also really, really bad for your immune system, for your hormone balance. All your hormones have to be eliminated. And guess where they get eliminated? Through your poop. And a bad, dysfunctional digestive system is bad for your mood. A problematic digestion means increased risk of inflammation in your body, allergies, rashes, increased risk of autoimmune disease, as well as setting the stage for an increased risk of cancer. Many people have no symptoms, or they forget that they have diarrhea that alternates with constipation, and most people ignore it and don't discuss it. But you should be aware of your body and especially your digestion. Any excess gas, frequent and persistent bloating with maybe some foods, but maybe most of the foods, is a possibility you might have SIBO, small intestinal bacterial overgrowth. That means your dysfunctional microbiome is not just in your colon, it has now colonized your small intestine, which is normally sterile, and that is not good. Small intestinal bacterial overgrowth, also known as SIBO, SIBO, can cause serious health escalating problems, like decreased absorption of all your macros, decreased absorption of your fats, your carbohydrates, and proteins, because your bile salts, which are normally needed to digest the fats, will be broken down by this excess bacteria in your small intestine, resulting in an incomplete digestion of fats, causing diarrhea. The rapid transit, the diarrhea, the deficiency in digestive enzymes and bile acids or bile salts will impact your intestine ability to absorb nutrients, will cause deficiencies of all the major vitamins, especially vitamin A and vitamin E. And also the excess bacteria in the small intestine may actually use up the nutrients your body needs to function well. So guess what? You may become malnourished. Not in the sense that you're thin and losing weight, unfortunately. It's just you're nutritionally deficient. So now you're tired, your hair is falling out, your hormones are a mess, your mental health is not good, and you wonder why. The excess bacteria in your small intestine can also damage the lining of your intestinal wall and create inflammation, which has been linked with immune system dysfunction and mood disorders like anxiety and depression. There's much more to say. Obviously, this is not an episode about SIBO. It is about the wellness exam and the review of systems in your 30s and how important reviewing your gastrointestinal system is. So to end here, please share with your doctor, ideally all the issues you might experience, even though you don't have them at the moment. We didn't have them this month or last month, but you've experienced them in the past 6 to 12 months. They come and they go. Any issues that you might have had, your doctor needs to know because that is valuable information. And again, a doctor that will ask you about all these signs and symptoms and take the time to do a thorough, comprehensive review and analysis of the systems in your body is a doctor you want to partner with. It's not a doctor that's meant to interrogate you and is just excited to find out things about your health and check boxes on your medical record that he or she will do nothing with. That is valuable data that will point out 2 possible issues. Remember, use this review of symptoms or review of systems as a self-tool analysis. And before you even see a physician, consider looking at constitutional symptoms, eyesight, ear, nose, and throat, cardiovascular health, respiratory health, digestive health, whatever I reviewed in this podcast, and then what I'm going to review and discuss in the next podcast episode. And please come to the doctor prepared. It will make things so much better, so much smoother, and present to your doctor a great picture of your health status or the health problems that you might face and be confronted with so that he or she can fix them. I'll see you next week. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.